We will talk about 5 causes of chest pain, and when people say chest pain, they usually mean that it is caused by heart. But that's not true, because in reality only 10% of chest pain is caused by heart problems. So only 10% of cases when person says that he has chest pain is caused by heart problems. Other 90% of cases is non-cardiogenic. It's not because of heart, and we will discuss what are the most common causes of chest pain. But we always should rule out heart problems. Why? Because myocardial infarction or heart attack is number 1 cause of death in the world. So because heart attack is number 1 killer, we should always rule out heart attack or myocardial infarction when person says that he or she has chest pain. And we have 2 main types of chest pain when it is caused by heart. First is myocardial infarction. It's very severe condition and serious condition, and its resolution can be death also. And another is angina, and angina is only narrow blood vessel, and narrow blood vessel causes less blood to the tissues, and it causes pain in the heart, but it is transient condition. It is temporary condition. And when myocardial infarction happens, it's usually permanent damage of heart tissue. But when angina happens, it's temporary narrow of blood vessel, and it's usually very reversible condition. So let's start. What are the most common symptoms when chest pain is caused by heart problems? First and most important is crushing sensation just center of the chest. Crushing sensation, squeezing sensation, and pressure sensation, and tightness and heaviness, and person is unable to touch the point or pinpoint about his pain because it's generalized, it's everywhere. It's like crushing or constricting the heart. So it's very important sign. This crushing sensation and pressure sensation, it's more likely caused by heart. And pain spreads to left arm, jaw, or neck, or back. So if this pain spreads, if this pain radiates someone, usually neck or jaw or hand or back, it's usually also because of heart problems. So this pain spreading, pain irradiation is sign of heart problem also. And commonly, and very commonly, it is triggered by physical exertion. It is started because of physical exertion, because of cold, or because of stress. Or to simplify, something happens and after this person feels this crushing sensation. So maybe person run fast and he feels this crushing sensation on his chest. It's because of heart. Or maybe person gets stressed too much and he feels this pressure sensation. It's also possible because of heart. And pain lasts for several minutes usually. If it's angina, if it's milder form, pain lasts for several minutes, and it is relieved by rest or nitroglycerine. So if person intakes nitroglycerine, he feels better. If he rests, he feels better. That's angina. So it's relieved by rest or by nitroglycerine. Or if it's cardiac, if it's heart attack or myocardial infarction, rest or nitroglycerine does not help. So at this case, pain is constant, and pain can last for hours, sometimes for days. So if pain lasts more than several minutes, and if it's heavy heaviness sensation, squeezing sensation, crushing sensation. It can be heart, and it can be heart attack, and it is emergency condition, and as soon as hospitalization is important and medical help is important. So what are other associated symptoms of cardiac chest pain? There can be shortness of breath, nausea, vomiting, sweating, or fear of death also, but these symptoms are secondary. Person will always focus on heaviness or crushing or pressure sensation. It's very important because you should not confuse the symptoms, what is primary and what is secondary. Primary here is always this chest pressure sensation. And age is very important. Cardiac chest pain is more likely after 50, or in case of men after 40 also possible, if person has diabetes, if person is obese, if person has a high cholesterol, that such a person has increased risk of heart problems. Now let's discuss what is the second most common cause of chest pain. Actually, it's not second, it is the most common cause of chest pain, but it's not most important. Most important, cardiac chest pain. That's why we discussed it as a first. It's not most common, it's most important, but most common is chest pain because of anxiety and panic attacks. So psychological chest pain is 50% of non-cardiogenic chest pain. So if it's not because of heart, more likely in 50% of probability, with high probability, it is because of stress, it's because of panic attack, because of anxiety, because of psychology. And interestingly, anxiety and panic attack chest pain very similar to heart related chest pain. That's why we should be very careful. First and most important is that usually such patients are younger. It's very important because if person is, for example, in his 20s or 30s and no history of cardiac problems, and she says that she has chest pain and fears of death and feeling of impending doom, or she is very afraid and trembling and sweating and heart palpitations, and she says that her heart is pounding, then it's more likely it's panic attack. It's not heart problem. Usually it's not heart problem. But if person says that he has heaviness in the heart, heaviness in the chest, crushing sensation, and person is 60 years old, we should first think about heart. That's very important. What are the other symptoms of anxiety and panic attack? Feeling of impending doom. It's very important because people will frequently focus on it, and hyperventilation, they are breathing fast, and they have fear of death, and this attack starts suddenly, abruptly, and it goes as a waves. It comes and goes. This panic attacks comes and goes over, and it will resolve within 1 hour usually, and it has wave-like nature. But these heart problems has more constant nature, so this pressure is more constant. It's not wave-like, but panic attack is more wave-like. And patients usually say that the pain is sharp and stabbing, and they breathing rapidly and sweating and trembling, and maybe they say that they have tingling and numbness in the hands or feet. It's important also, it's sign of panic attack also, not radiation pain, but numbness or tingling in the hands. It's panic attack, and such patients respond well to reassurance. So if you calm them, they will be calm. But if you try to calm person who has heart attack, your calming and your trying are zero. It will not help. But such people, reassuring helps. Breathing exercises help. If you said to this person that breathe deeply and slowly, it will help. If this person intakes anxiolytic medication, it will help. So it's very important distinction factors that if it's angina, nitroglycerine helps, but here reassurance helps. If it's angina, rest will help, but here rest will not help. If person lying down and tries to be calm, it will not help when there is panic attack. But if it's angina, it will help. Sometimes these people feels shortness of breath or chills or heat sensation or paresthesia or sense of unreality or depersonalization. What means depersonalization? For example, they have feeling that they're watching themselves from far. So they're watching their own body like movie. It's depersonalization. And sense of unreality means that they think that what is happening is not real. It's also possible. So psychology and anxiety and panic attack is very important cause of chest pain. And gastroesophageal reflux disease is very important cause also. It's called GERD. GERD is very huge problem for most people. And how can we guess that it's GERD and not other causes? Because here we have burning sensation. Burning sensation is very important. Heartburn, acid reflux, regurgitation. What it means? Person says that he has feeling that his food is coming back to his throat, or he has feeling that something acid back to his throat, and he feels his throat feels irritated, or he has bad taste in the mouth. It's GERD, gastroesophageal reflux disease, and these symptoms will worse when person lying down. If person lies down, symptoms worse. If person eats, symptoms worse. So after eating, after lying down, symptoms worse. It's very important. So if cardiac problems or heart problems are associated with physical activity, GERD is associated with eating. When person eats, this acid and food flows back into throat and person has symptoms. And if person has lump in the throat, it's also very important sign, because people say that I have sensation lump in the throat, and what is it? Is cancer or what? No, it's not cancer. In 90% of cases it is because of GERD, because this acid irritates throat and you have sensation of lump in the throat. Another common cause of chest pain is muscular skeletal chest pain. It's also very important, and how we can guess if there is muscular skeletal, it's very important also. Here person can pinpoint where the pain is, can localize pain, can direct where is pain, and if you apply pressure, pain increases. So this pressure applied on the skin increases pain. Pain is sharp, aching, and it will worse when you're moving, when you're coughing, when you're sneezing. The pain worsens. So if pain worsens during movement, it's usually musculoskeletal chest pain, and person can even remember that he had any physical activity and muscle strain. Or costochondritis is also common. Costochondritis is inflammation of cartilage which connects ribs to sternum or breastbone. Breastbone is here, central bone, and here is ribs, and the connection are cartilage, and inflammation of this cartilage causes costochondritis, and commonly it is caused pain which can look like heart chest pain, but here is very simple distinction that if you press, pain increases. In case of cardiac pain, it will not increase. It's very important. And fifth most common cause is respiratory chest pain. It is caused by pleurisy, for example, or bronchitis, or pneumonia, or asthma, or any lung problems can cause chest discomfort and chest pain. But usually here person will say that my chest pain will increase when I breathing deeply. So it's associated with breathing, and or during coughing, or during sneezing, this sensation of chest discomfort increases. So it's very easy to identify from others that it's usually correlated with infection, for example, or pneumonia, for example, or bronchitis, or asthma symptoms, or person has coughing. And so you can make distinction because of such respiratory oriented symptoms. Here chest pain is not primary, it's more secondary. So we should define what is primary and what is secondary. Primary at this case is respiratory symptoms, for example coughing, sneezing, and deep breathing, which increases this intensity of pain. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.